Hi, my name is Dr. Ahmed El Kuleli. I'm internist, board certified, practicing in New York State. I am here to start my YouTube channel because I feel it's my responsibility to educate the people of New York and United States and everywhere else in the world about our main concerns now, especially in the medical field, which is COVID-19 pandemic. We need to educate the people not how to treat it because this is their physician's responsibility. My responsibility is to help them to survive the pandemic because number one, in the beginning everybody was saying this is not a big deal and that's why people did not take it serious. So it became like a lax intervention to prevent it. That's why we are here now with a pandemic. Pandemic means everywhere in the world, a lot of people dying, a lot of people getting the disease, a lot of lives got changed. So our mission here is to help people to understand how to live with this condition. Because I will make my opinion very simple. This pandemic is similar to the pandemic of something called Spanish flu. Spanish flu happened almost 100 years ago, and it was worldwide, and about at least 50 million people died from it. This pandemic of the Spanish flu killed the people over 3 years. The first wave came and killed few millions. The second wave was bigger and in the second year and killed more people, and the third one was less. And now we are living with the Spanish flu, with what we call it now seasonal flu, which is the flu that we are familiar with and we get the vaccines for it. So I believe the course of I hope, the course of the COVID will be similar to this. And what really make me start this initiative and work on it, because I was very hesitant. I'm not really public speaker. I'm a doctor, a physician, clinician. I teach students, but I am not really public speaker. But I'm trying to work now with the public health people and help our public health people to find simple solution to prevent the increased number of COVID-19 or the spread of it, and make the second wave less harmful than the first wave. The biggest thing that really take my attention and make me rush to do it now was the diagnosis of our president, Mr. Trump, with COVID-19. And I believe his condition was not simple as tried to show. It was really, every disease comes in mild, moderate, and severe. I think he got it in a moderate severity, and he was taken care of in the best place for the care for this because he's the president and he deserved to get this treatment. But I don't think every one of us will have the opportunity to be treated the same if we contract the disease. I'm one of the victims of this disease that happened to me early in March, and my wife too. We didn't have opportunity even to get tested because the testing was not available at that time. And also there was no opportunity for nobody to get tested, or even the PPE, personal protective equipment, was not available for us. And this will be our, next videos that we're gonna start. And the first video we're gonna start next after this introduction of my biography we'll call it What Went Wrong. So I will advise you to see the first video when it's published, and I'll try to make it simple for the simple people. And again, I am not here as a physician. I'm here as an advisor, as a person who give advice, person as helping people with the mental issues and the stress issues and how to live with this disease and how to make it less harmful to all of us, because the disease can be very harmful, take life right away, and make people in a ventilator or a hospital, or make them very debilitated, or make it moderate and affect them and cause the fatigue that happened to me and many other people I know. And some of my friends, like one of my very close friends, he's an attorney, he has to retire because he got the disease and he was not able to function after it. So we need to learn how to live with it and how to make the best out of it, and to limit the damage that will happen to all of us. And this is my main concern here, and this is my responsibility, because I feel I'm responsible to educate myself, educate my family, educate my people, educate my patient, and the other people in the United States and other countries. I will make a similar videos in Arabic, because this is my native language for the people in my original country, Egypt, and other Arabic-speaking countries. I am working with my daughters who are in the track of medical field, and I will try to convince them to make videos in Spanish and maybe in other languages they can do it. And we'll try to educate people as much as we can and try to make the second wave of COVID-19 easier than the first wave. Before the end of this video, I just want to thank my daughter, who is behind the scene here, that she was able to make me able to get this video done, because I'm not really computer or technology savvy, and I'll try to educate myself in this field. Thank you very much for listening to me, and I will see you in the next series, which will be what went wrong with the first wave of COVID-19, so we can avoid it in the second wave coming. We're not gonna wait until we get hit and then we wake up after we are drowning. Thank you very much and have a nice day. God bless America.